I'm honored to welcome you to this symposium on digital diabetes education, where we will explore innovative approaches for diabetes management and education in this digital era. I'm Professor Maimouna Ndourmbaye. I'm specialized in internal medicine, diabetology, and public health, and I'm director of the National Diabetes Center in Dakar, Senegal. And I'm particularly delighted to co-chair this session with Mrs. Angelica Namda from Suriname. Angelica, would you like to introduce yourself?
Good afternoon, everyone. Do you hear me? Like, it's always a challenge. Yes. I'm Angelica Namda from Suriname. I don't have a medical background. In fact, I'm an infrastructure engineer, specialized in spatial planning and urban planning. But since I'm diabetic, I'm involved for more than 25 years. I'm involved in this topic. So I'm really looking forward to the presentation and maybe discussion. I have a meeting at 5, so if you see me going out, you know that I'm late for my meeting. Thank you.
Wonderful. Well, as you all know,
这样超载。
为什么觉得电脑会怪？做图不是很顺。
网络卡卡是吗？
可我用的手机的网络。
难不成下雨天影响甚巨？干嘛？36分。36。晚餐老公有想法吗？
不知道。
So, diabetes is a growing global health challenge, and the digital health presents exciting opportunities, right, to enhance education and management strategies for our patients. And today we will hear from two distinguished speakers. Our first speaker is Mrs. Anwar, I hope I pronounced it well, from Pakistan. Mrs. Anwar is a person living with diabetes and a certified diabetes educator and one of the pioneers of the only patient-centric organization in Pakistan, am I right? Known as Miti Zindagi. It is well pronounced? Oh, thank you. Oh. So, Mrs. Anwar, please come to the stage and share your insights on digital education for children and young people with type 1 diabetes, please. Learnings from UK. And I have to say that Mrs. Anwar is not feeling that well. So if you want to sit, please let me know.
Bear with me.
Okay, you have the floor.
So, thank you so much for your kind introduction. And this is Anna Manvar from Pakistan. I'm a diabetes advocate living with type 1 diabetes myself for more than 2 decades now. And I work with Miti Zindagi primarily on education and peer support projects. And today, the project I'm going to present here is very dear to me because it has changed a lot many things in our country. This project, Digital Diabetes Education, is a combined initiative of DigiBeat UK and Miti Zindagi, and it's funded by World Diabetes Foundation. What I'm about to say is going to connect with my friends who have type 1 diabetes themselves. Be it a bustling city or a village, type 1 diabetes does
我有一
not
张
differentiate.
路网图啊，我本来想用地图做，但我
Imagine
发现
being
地图一直说
diagnosed
说
with
说很
type
小的
1
时候，
diabetes,
其实塞东西密密
where
麻麻的，整
due
个
to
画面
lack
不
of
好看。
awareness,
但是我又不很想，我
nobody
又
is
不很想
there
说我要
to
用
tell
去
you
用
what
空
to
白方
do
式去
on
做
day-to-day
跟车去
basis,
跑那个轨道，因为我跑去跑那没有意义，
where
那边
access to
晃下来抬
care
头很大
is
圈。
limited.
我想
and
要用精
survival
简的，但是
feels
跑光速
uncertain.
那个东西我做不出来。
Just imagine for a moment those life-changing words that an HCP tells you
我觉得我
that you
瞬
have
间
got
我的
diagnosed with type 1
身体不快
diabetes.
怎么了？
This changed the
是
whole
太多
life.
药，
And that's the
Yeah.
reality for many
怎么样
children
的怪
and
怪
their
的？
families in low resource income countries.
就
支持不了。
As per
好好地
T1D
先找
index, Pakistan has almost 1 into 2
说了半天会不会你们才是有
like
感？
Pakistan.
那
Sorry,
你是怎么看？
as per
什么
T1D
不是？
index,
是无感。
in Pakistan, every 1 is to 2 people lose their life, not only due to lack of access to insulin, but also because they lack access to care and education. Almost 40% of type 1 population of a country losing their lives due to this reason is a mind-boggling number. And we are doing really poorly in this context with, if you can see the map here, Pakistan's data shows that 47 years, healthy years of someone's life is lost just because of unavailability of these resources. Given the magnitude, the impact multiplies these set of challenges here. But for the sake of this talk, I would only focus on the limited structured diabetes education for type 1 diabetes. Our healthcare system is already overburdened with 1 is to 1300 ratio of patient to doctor. And then when there is very less time for any personalized care, and with high prevalence of type 2 diabetes, there are lots of myths and misconceptions. With this, another added thing is technology gap. Due to poverty and literacy barriers, not everyone can access to those things. So, with a population of more than 240 million people in our country, and when the healthcare system and the funding is not sustainable, training HCPs on regular basis or doing regular community events is not a sustainable model for educating them. Also, most of the healthcare providers are located in bigger cities, and those who are in the underprivileged areas are very less in number and not very well trained to deal with this dilemma. With these challenges, when traditional methods fall short, we thought to bring some innovation and bring a digital solution that can go to the masses. Fortunately, we came across to DigiBeat UK's educational resources that were successfully being implemented by NHS UK, and we felt like we can implement the same in our country as well. As digital education is more sustainable, easy to access, scalable, and cost effective as well. But just having the resource is not enough. Being a community-centric organization, we need to develop the content that community can connect with. We often heard from our community members that they are tired and bored reading the same materials, getting the same yellow, blue, green charts, telling them what to eat, what not to eat, and no more information regarding the management of type 1 diabetes on day-to-day basis. Hence, we adapted a model of co-creation and co-design by conducting local stakeholders engagement, including not only HCPs, but also the type 1 community and caregivers all together. This allowed us to put end users at the heart of the process. This allowed us to create a resource that makes sense to the end user. That's the community. That is understandable for them, that is useful, interactive, making sure that they can get maximum benefit out of it. This holistic approach of culturally tailoring the content, choosing the right language, taking opinions of all stakeholders in every step of the process, right from the content creation till the final reviews, was a very exhaustive yet a very insightful process, because not only me, but most of our members who were in the co-design team gave this opinion that every meeting, every co-design process was more insightful, was a new learning for them as well. And today I stand proudly to present our online resource, a digital diabetes education platform for people with type 1 diabetes by the people with type 1 diabetes. The resource is named as Tidbits, and I would like to acknowledge my creative team who came up with this idea to give this name, T1D Bits or Tidbits, little pieces of type 1 diabetes information. Another thing that we tried to do in our capacity was to making it as simple, as relatable, and deeply rooted into our local language so that it could serve the masses. And now let's talk a little bit about real impact. Since our launch a year ago, the results are really promising as evident. In last 60 days, we have seen 6,000 plus website users, and then 12,000 plus videos have been viewed, spreading diabetes education and awareness across the country. Despite our understanding regarding the content, to our surprise, the videos that have got the maximum plays were a guide to healthy eating, carbohydrate counting, instead of how to check ketones, because we feel like diet, exercise, and carbohydrate counting is something that we go through on day-to-day basis and is very important to manage type 1 diabetes effectively. One of the strange facts that was revealed from the feedback was that those type 1s who have access to insulin didn't know how to inject or administer insulin correctly. This was something very revealing for us, but after visiting the website, seeing the videos and seeing the visuals, things started changing. The wrongs started getting right, and that was really amazing. And let's hear from one of our beneficiaries.
अस्सलामुअलैकुम, मेरा नाम ईशा है। मुझे तकरीबन 5 साल से शुगर है। मुझे पहले इंसुलिन लगाने का तरीका नहीं आता था, जिसकी वजह से जिस जगह पर मैं इंसुलिन लगाती थी उस जगह पर मुझे काफ़ी दर्द महसूस होता था। मुझे मेरी की टीम ने कुछ वीडियोस सेंड की जिसमें इंसुलिन लगाने का सही तरीका और भी बहुत सी चीज़ें सीखने की वीडियोस पूछी थी, जिसकी वजह से मुझे अब इंसुलिन लगाने का दुरुस्त तरीका आता है।
की वालदा हूँ और तकरीबन 5 साल पहले इसकी अचानक से तबीयत ख़राब हो गई। जब हॉस्पिटल लेके गए 3-4 दिन उन्होंने एडमिट रखा। उन्होंने शुगर का टेस्ट किया तो उसमें इसकी शुगर हाई आ रही थी। शुरू के दिनों में हमें बिल्कुल नहीं पता था कि क्या करना है। अचानक इसकी तबीयत ख़राब हो हमें हॉस्पिटल ही जाना पड़ता था। मगर उसके बाद जब से हमारा राब्ता मीठी ज़िंदगी वालों से हुआ तो उन्होंने हमारे साथ बहुत ताउन किया, हमें हर तरफ गाइड करते हैं। अगर इसकी शुगर हाई होती है, लो होती है या कोई तबीयत ख़राब होती है तो आप इस तरह करें। हमें बहुत ज़्यादा आसानी हो गई है इसको हैंडल करने में।
And it's not just about insulin administration, but we have many examples like this, from treating hypos to what to eat, not to over-treat, etc. So all of this have an impact on overall diabetes management. And as per our feedback forms present on our web platform, we got to know that 80% of type 1s responded or reported that they have improved their diabetes management skills after visualizing these resources. And 70% of caregivers felt confident, equipped by getting this basic knowledge of day-to-day issues. Also, 85% of HCPs reported better engagement of their T1D cohort after exposure to the resource. So the challenge of accessing to the remote areas was another thing, because the website alone could not reach to the masses. And in a country like Pakistan, where there are connectivity issues, high poverty rate, because of which not everybody has access to Android devices, there was a need of creating another solution. And access to education, in our opinion, is not a privilege, it's a right. So hence, we established 20 centers across Pakistan that could cater the needs of those living in rural areas. It increased the knowledge accessibility in every corner of the country, and it has been done by taking local facilitators on board. And with the phase 2, we are planning to dub the resources in different local languages so that education for type 1 is not restricted to ethnicities. So to bridge the gap, that's what we are focusing for phase 2. And I would also like to acknowledge the support of our collaborating institutes who understood the need of this resource for type 1 community and willingly came forward to address the barriers. The education in these centers are duly trained by our team. They use our implementation framework to educate T1Ds in face-to-face manner by doing different interactive sessions. And this addresses the digital barriers by on-site learning, and also improves the personalized care thing, because lots of myths and misconceptions are combated by this. And when we talk about the centers, I would like to share a few numbers here. Around 1187 people with type 1 diabetes got educated among these centers, and among those, 200 were also post-evaluated because they have visualized the resource at least once. And when we did that, we got to know that among those 200 participants, 65% of the population had a reduction in HbA1c and decreased rate of hospitalization due to decay. and a glimpse of knowledge improvement. So if you see the graph here, this is just mentioning about one particular module that's related to physical activity and type 1 diabetes. As you can see here, there is an increase of knowledge up to 61% regarding the awareness of hyperglycemia triggered by exercise. 70% increase of knowledge regarding the intake and type of snack that has to be consumed before or during exercise. And 59% increase of knowledge of physical activity. This module debunked lots of myths and misconceptions that caregivers and type 1s themselves had, because many people feel like once you got diagnosed, you should not remain physically active. So the success of this Tidbits project is our collaboration with another community-centric organization, DigiBeat, shown us the power of working together. It's just a beginning. The journey is long, but with collective effort, it can truly be transformational. And with that, I would like to invite two of my colleagues to showcase their role in this project and overall. Maddie and Salma, if you could join in.
Thank you so much, and rarely do I become speechless, but it's absolutely amazing to see the impact this work has had, and actually, it's incredible. So I'm just going to march on, and Salma will come and join me. Salma, do you want to join me at the microphone, and then we can kind of do it together. So we have, we have the power of our collaboration has been really, really important, as you could see from the slide before there. There is, there's been an enormous amount of work together. And DigiBeat, I think it's kind of gone on to different slides. Okay, DigiBeat was created in 2000 and, keep skipping the slide, sorry. That's the one. Okay. Time I press that?
Just one.
Okay. Maybe I don't need to press that. Okay, fine. Sorry about that, everybody. I thought that was the microphone. Right, so DigiBeat was created in 2016, as Adam's mentioned. We are a community tech for good company. We were set up as a not-for-profit in the UK because after our son was diagnosed, we felt that absolute sinking feeling of what do you do in the middle of the night, how do you manage diabetes. We were given good care in hospital, and we were very fortunate, obviously, living in the UK, that we had that team. But out of hours is still really, really hard, and I cannot imagine what it must be like for families living in the rural areas of Pakistan and beyond. We've scaled DigiBeat over the last 10 years to provide this information, and crucially, to make sure that everybody has out-of-hours support. We now have a Type 1 and Type 2 platform. We're evidence-based. We have health economics and real-world evaluations behind it. And why that's important is obviously we can then share that knowledge with our partners in Pakistan. We're also doing some work in India with Breakthrough T1D, and really to make sure that we can scale out this information to as many different cultures. We have always believed that we need to level access to healthcare to all communities, and in the UK we have an awful lot to do there as well. And so DigiBeat was always set up with the mindset that actually, okay, we might be okay, but what about all these communities that speak different languages, that have different circumstances, and also are living in poverty? So Salma, I don't know if you want to say something about that quickly before we move on.
So the work we've done in the UK reflects the diversity. So we created a number of resources community populations that we serve, and then we started translating materials into commonly spoken languages after English, with Arabic, Spanish, Gujarati, Urdu, Polish, Bengali, ensuring that these communities also access the resources. But our pure focus is really around the cultural diets and the cultural needs of our communities. So focusing on the different type of carbohydrates, the festivals, and also the sort of the social economics of these communities. So you can see some of the resources that we've created in the UK, which then translates back into Pakistan. So whatever we do, we then share that with our teams in Pakistan, and then they develop localized resources, just like the way we do in the UK.
I should say we also spend quite a lot of time on the emotional well-being of diabetes as well. So looking at coping with diabetes, we have a specific coping with diabetes tool within the DigiBeat app, which allows our young people of our age to get the right information about how their emotional systems are worked. This has been designed by the psychologists, the Psychology Network in the UK, and then it's disseminated across the country. So how do we take the best and get it out to everyone? That is our job. That is our mission within DigiBeat. We've developed other self-management platforms as well, including a schools, diabetes in schools platform, a young type 2 platform. We've developed an academy training platform for technology, and also a transition platform for young people transitioning into adult services. This is healthcare professional platform, training platform, to meet the needs of those young people as they transition. If you're interested in the work that we've done, you can have a look at our latest impact report on the QR code there, which will give you a good flavour of everything else. I'll send you in a second. And then I think coming back to Anam, but I just want to say, you know, we are incredibly proud to support this project, and the next phase will be about how we develop the app, which is going to be crucial in Pakistan. If anybody's interested, please do contact Anam to talk about the Pakistan project. Salman's just going to have a little plug for one of the World Food Books as well that has been created.
So with this collaboration, we've also had the opportunity to develop a carb counting resource specifically for children with type 1 diabetes in Pakistan with the support of ISPAD, Life for a Child, and we were really pleased to be part of this project, and I wanted to promote this today as this collaboration. So if anybody is interested, you can either contact Anam or myself, or go directly to the Life for a Child page, and it will give you the full content of the full version of the Pakistan resource that we created for the carb counting.
Lastly, just to say, the DigiBeat websites are up there now. You can use any of those for free. They've got 300 or so video resources on them. Well, actually 500, including the type 2s. That's young type 2, so this is early onset. And the type 1 website's got a huge amount of information. Use the search button. It's all broken down via age, and it's based on the Goals of Diabetes Structured Education Programme, which has been around for a good deal of years now. So please do use those websites in your countries, and you can translate using the auto-translation tool. If you struggle, go to the accessibility page on the website, and it will tell you how to use the translation tool for yourselves. We also have videos in native languages, up to 12 languages, that are actually voiced over as well on different pages. So if you go to the Essentials page or Technology pages, you'll get all of those and guides in those different languages like Urdu and other languages. Okay, thanks very much.
Thank you everyone for your attention.
Will be later. I want to say great job, ladies. Great job. Thank you very much. Thank you for sharing this wonderful experience. You just showed us that the digital transformation in healthcare has the potential to revolutionize the way we educate and support people living with diabetes. And you showed it through this remarkable impact on what you just presented. And thank you for highlighting the importance of collaboration. So thanks to Madi and Salma. Thank you very much. I think there will be many questions later. We will wait for the Q&A. Thanks again. Well done. Well done. Now, I would like to give the floor to my co-chair to introduce the second speaker.
Okay, may I invite our second speaker, Sylvia Malou. She's a program manager at the and CEO of the Office of the Qatar Foundation, where she is strategically support of the foundation's policy efforts. Sylvia has a range of experience in strategic planning and other related topics. And she had worked for different international organizations. She believes in policy innovation as a critical tool to help enhance the patient's experience and well-being of all those affected by diabetic. So I think I can give you the floor. Her presentation will concentrate on that one.
Thank you very much for the kind introduction. Good afternoon, everyone. I know it's hard to stick around for a late afternoon session, so I appreciate you all being here. My topic is a little bit of a complex one. When we hear a lot in the Congress, we hear the words policy frameworks, policy change. And policy can sometimes be a little bit scary. It can be complex, it can be challenging. And I wanted to use this opportunity as a policy expert who has been in the field for over 15 years now to share some best practices and some examples using the case of my work in Qatar that we can build for diabetes. So the theme today that I would like to present is how we could develop national blueprints for multi-sectoral approaches and policy for diabetes prevention and care. And multi-sectoral approaches is key. We just heard about the lovely collaboration. It's happening across all NGOs, but it doesn't happen really well in our governments. So how do we achieve that? Just to declare, I have no conflicts to disclose in today's presentation. So as we all know, and all of you in this room are very well aware, non-communicable diseases like diabetes and those that lead to diabetes, like obesity, have been on an alarming rise. Despite the digital impact and the digital health and all the advancements in healthcare, the numbers that you've heard in the Congress today are just alarming. Diabetes is on the rise, obesity is on the rise, so something is not working. Diabetes is not a one single disease. It can be influenced by environmental and social conditions in which the person lives. It is influenced by social factors. It is influenced by lifestyle factors, by environment. Therefore, a single approach relying on one single ministry for policy, like the Ministry of Public Health, is not going to work. We therefore need to focus on diseases like diabetes, like obesity, on multi-sectoral approaches. But how do we achieve that? To achieve holistic multi-sectoral approaches, countries must develop policy frameworks that are intentional, and I repeat, intentional in the collaboration framework, where we bring everybody that needs to be included across the table together to discuss interventions that collectively achieve that systematic change. As you all know, there's been a lot of talk about integrated diabetes care. And the reason is simple. We all know that currently systems are fragmented. This can lead to delays in diagnosis. It can lead to dual diagnosis. It can lead to inconsistent management. It can lead to missed interventions that then lead to complications. There's cost efficiencies that we can gain when we integrate diabetes care. We can integrate models at hospitals. We can reduce hospital admissions, expenses, and we can reduce long-term complications. And of course, there's the role of holistic management. The previous presenter talked about education, mental health, the family. We need to ensure that we're looking at diabetes in a holistic way. There is a key role that NGOs can play, and a lot of you run NGOs yourselves, and the work that you do is fantastic. But NGOs need to be more involved in the policy sphere. They need to really advocate for policy change, and in entities like the International Diabetes Federation or the WHO and the Global Diabetes Compact need to be more active in advocating for that change. So I wanted to go through a case study based on my personal experience and work in Qatar, and it's about developing multi-sectoral policy approaches to prevent childhood obesity in Qatar. And what I was hoping to do is to sort of go through the journey to sort of deconstruct the myth of how do you achieve policy change and how do you achieve multi-sectoral policy change. So first of all, I wanted to talk a little bit about where I work. Qatar Foundation, it is a unique ecosystem. It is a foundation that houses schools. We have 13 schools, 3 of them specialized for special education needs. We have 8 universities, 7 are branch campuses, 1 is a homegrown campus. We have research institutes that look at everything from the environment, from the biobank, from the Qatar Genome Project. And we have research institutes that focus also on computing and science. And we have a lot of community awareness initiatives. We have the Qatar Diabetes Association and others. And I work in a team called the Policy Hub, and our role is to basically, very simply, bring it all together. Not an easy task, but we try our best to leverage that into evidence-based policy to support our national stakeholders and our government. Some recent examples are on the screen of the work that we've done, but they're just really there to sort of bring the story that policy, real, meaningful policy change doesn't happen in a vacuum. It doesn't happen in a silo. We need to bring the relevant decision makers across the table, to convene them, to get shared strategies across different ministries, across different entities, and to use national strategies that elevate the topics that we really care about. So the most recent successful example of that was the multi-sectoral approaches to prevent childhood obesity. Now this is an important slide because it shows you the timeline that it took to develop this policy. We started in 2022 and we got the policy approved in 2024. It was a full 2-year cycle. It started with an event similar to this one. The World Innovation Summit for Health is one of our policy initiatives that focuses on healthcare, and they run biannual summits. In that summit, our CEO, Her Excellency Sheikha Hind Afani, asked us to look at childhood obesity because it was such a critical problem in the country. It had been recognized as a need that hadn't been properly solved, that required, to get all the stakeholders involved around the table. So we then held a roundtable where we actually had a few members from the International Diabetes Federation who I've seen around, and we used some of our international guests at the event, and we brought together 5 different ministries from the country. So the Minister of Public Health, the Minister of Family, the Minister of Municipality, to our urban planner here, the Minister of Education, and the Minister of, I don't remember if I said Social and Development Family, but there were 5 ministers there to talk about one health issue, which was diabetes. So the fact that we brought them all together made them realize their individual roles and how each of them play a role in the prevention and management of childhood obesity. So we developed Childhood Obesity Roundtable, and we had a paper which was published on the proceedings, which led the Minister of Public Health and the CEO of our foundation to ask us to develop a working group to look at childhood obesity in Qatar and develop policy recommendations. So this is where you need your endorsements, you need your high-level stakeholders to really understand their role and give you that power to convene. We were then able to convene, and here we did something where we worked with the Healthy City Network. So in 2022, right before the World Cup, Qatar achieved a Healthy City accreditation for 8 of its cities or municipalities. So we leveraged and built on what was already there, because there's a lot of networks out there. You really have to get out and find them and build on them and collaborate, like the examples that we've heard before. And we ensured that all different actors from different sectors, different industries, gave feedback into the policy framework that we developed. And we then proposed it in a session looking at pediatric nutrition, and then it was taken up by the Council of Ministers. So when it was taken up by the Council of Ministers, a lot of the recommendations were taken on board nationally, and I'll highlight some of those in a bit. But then that led to the official launch of the document in 2024, which has all the recommendations that any ministry can adopt, and also the National Action Plan for Diabetes and Obesity was launched in the country at the same time. So if you're interested to learn more about the report, you can scan the barcode there. But basically, there's a few lessons learned from how we draft these reports and how you communicate these policy issues to your national stakeholders. First, you have to clearly state the problem. And those numbers are enough to showcase the problem. And I think in diabetes world, we have enough numbers to showcase the problem. We know the problem is bigger than we realize, and we need to state it, but articulate it very clearly. So what we did was we highlighted to the Qatari officials the prevalence amongst the children aged between 5 and 14, and how much it had been rising over the past few years. The trend was more alarming than the number itself, to really highlight the need that you needed to do something, and you needed to do something now. Furthermore, the long-term risks of this obesity epidemic meant that a lot of the population would develop diabetes very soon, which we couldn't afford to have. And then we looked at different levers. Who are the key players? Who are the different actors? And developed an intervention at 6 levels, from clinical practice, to school settings, to food and nutrition, family and community, the built environment, and the first 1,000 days of life. And you would be surprised how powerful this framework was, because it basically showed how everybody plays an important role in the reduction and the prevention of obesity, in children in the country. And we then had, if you go in the document, we found an annex that has a whole shopping list of recommendations and health recommendations that I've highlighted a few. So when you look at clinical practices, we talk about, trials and testing and following children and trying different interventions. When we talk about the school setting, we talk about basic things like nutrition education or healthy canteens. Our kids spend most of their days in school, and if you see what they sell in most schools, you would be appalled. Ensuring healthy, walkable school environments so that kids can walk to school, so that kids can cycle to school. When it comes to the first 1,000 days, I mean, there was a comment in one session yesterday that there's too much focus on maternal and child health. There should be a lot of focus on maternal and infant health because it all starts from the womb, from before conception, right? The woman needs to know what the nutritional needs are. She needs to know what her own health is like to be able to give her best to her child and know how to then raise a healthy child. So those years, and particularly the first few years of life, are critical. We talked about the built environment. It is the responsibility of every municipality or ministry or Ministry of Public Works to provide everybody with accessible, green, walkable, safe spaces. We need cycling lanes. We need healthy air. We need clean air. Because a lot of the obesity pandemic is stemming from time spent indoors. And the more that we have pollution, the less green spaces we have, the more that our kids are behind their phones, their screens. They're not going outside, and we need to really, really ensure that in our planning, we're ensuring that there are spaces for safe play, for outdoor activity, for being outside and walking. Food and nutrition, guidelines on food and nutrition. One of the key things that I struggle with, and I'm sure a lot of you with diabetes here as well would know, is with nutrition labels. Half the time, the labels are so small and so convoluted, we don't even know what's in the ingredients of our food. So simple policies like a traffic light system or star systems or stickers that highlight sugar content and or embolden, sugar content, fat content, sodium. So highlighting those and having a clear policy that is unified across a country can be so beneficial and can really change behaviors among people and really help parents of children with diabetes, with obesity, etc., or people themselves to make better, more informed decisions on the things that they're eating. And of course, not to forget the family and the community. There are a lot of interventions that can be done at the community level, working with local community centers, with religious institutions, mosques, churches, shrines, to really help build the message of the importance of healthy eating, nutrition, etc. So what are the key messages? Policy change takes a long time, and we have to persevere. There's sometimes a lot of closed doors when you go to your policy officials, your policymakers, your politicians, but we have to keep trying. And it is important that when you're looking at multi-sectoral collaborative policy change, that you have high-level endorsement. So the fact that we were able to get our report presented at the Council of Ministers meant that that endorsement was there. The fact that the Minister of Public Health and the CEO of the foundation asked us to create the group allowed us and enabled us to convene people that normally wouldn't get together. So find those cheerleaders, as I like to call them, find those sponsors that care about the issues that you care. Communicate them in a way that really makes sense to them so that you can convene them on the room, and you'll be surprised by the magic that can happen when you get that scenario. So from the policy report, I'm happy to showcase that one of the key recommendations was creating a task force for childhood obesity, and that was taken very seriously by the government, and it was set up already in Qatar. It is active. It has members from the National Ministry of Public Health, as well as the Hamad Medical Corporation, the Primary Healthcare Corporation, Qatar Diabetes Association, and the Qatar Foundation, and it meets every month. So very seriously taken on board. And from the other recommendations, the school-based interventions are being piloted within our schools in the Qatar Foundation. So we hope to be able to have some evidence scenarios to be able to go back to the Ministry of Education and say, okay, time to roll it over to all the public schools. It's worked here. Because a lot of times our policymakers, they need to know that it works. They don't want to try something and fail. So being able to have environments where you produce that evidence is really key. And we're also trialing a lot of community and family engagement with our Family Policy Center, where we're doing sessions, parent education sessions about nutrition, about myths that you should be giving your kids, sugar in their water, for example, and why they're not necessary, or some cultural misconceptions, which are really important. And when it comes to the first 1,000 days, they're looking at actually banning promotion of milk substitutes in hospitals for women who have just given birth to promote breastfeeding, which is, I think, a huge achievement. And like I mentioned, the National Action Plan was launched right alongside the policy recommendations. Three things that I want you to keep in mind when you're trying to advocate for policy change in your own countries or your own scenarios. Always have a clear implementation timeline and always provide options. So we provided short-term policy options, medium-term, and longer-term options. So that way you have like a level to choose from. Because if you just go for the long-term 20-year policy change, no 4-year term policy official is going to look at your recommendation. So you have to really provide the options and get them motivated about starting the long-term change with small, quick wins. When it comes to highlighting who's in charge, we were very clear at highlighting the key stakeholders. We had leads for every single policy recommendation, and we had who's also contributes. So that if the lead wanted to take it on board, they knew who to talk to, and they knew that we'd already spoken to them. So that was very important and made it easier to adapt certain policies. We listed the NGOs. The NGOs are so critical. Find every NGO in the country that you are and work together, because you each bring so much to the table, and we can only amplify and support our voices. And of course, we found the international partners. So who are the key international partners for the policies that you want to change? And the third message is always make sure you have a call to action, right? So we were very clear, establish a childhood obesity task force. Very clear, ask, not, it would be great if we worked and talked together, right? So we have to be clear when we ask for these policies. And you have to leverage what exists. So we had a Qatar National Development Strategy. We are making sure that in the next iteration, obesity is highlighted as a key concern, so all ministries are involved. I mean, just working in this and seeing the role of the IDF, I just wanted to highlight that the International Diabetes Federation can play a role, and organizations have a huge role to play, and they can do so by providing community-based programs, evidence-based data. They can set standards to help countries manage and to help NGOs base their information. A lot of the information we used was from the WHO or from other resources, International Diabetes Federation, and you'd be surprised how little there is, how little country-specific information you can actually find. So having more access to that and providing more of that information is really pivotal to help move that policy needle. They can also, of course, highlight the need for collaboration and connect people and set guidelines for patients and tracking. So there's a lot of roles that are very important in achieving this impactful multi-sectoral policy change. And finally, just wanted to link it back to the conversation on diabetes education. I mean, the digital diabetes education is a critical tool, but digital elements in general can really support and benefit and help us in today's world to connect. I mean, we're more integrated and connected than ever, but the access to data that we have today is something we haven't had before. So the ability to be able to make real-time policy decisions and to share it across different platforms and ministries, whether it's on air quality, whether it's on nutrition labels, you know. This was something that was trialed in the World Cup, for example, in Qatar in 2022, where they developed a joint committee on air quality, where they would monitor air quality before a game, and they would take decisions about moving generators, if there was too much pollution, about moving the way people were walking, if there was a certain corridor where the wind was polluted. And we can do the same with diabetes now more than ever. So we can look at the trends, we can look at how our population is doing, and we can really share that data to be able to create those real-time decisions. And of course, the ability to create individualized programs. There is no one-size-fits-all for diabetes. There is no one policy fits all. So we have more, we can really now look at individualizing those programs in a way that we never have in the past. And as someone with type 1 diabetes for the past 18 years and running an NGO in Lebanon, I think the digital healthcare revolution is really something that we really must take advantage of. And I hope that if you take a message away from this presentation is that go out there, find your policymakers, frame the problem correctly, provide them simple solutions, show them that it works, make it a win for them, and find your cheerleaders and your collaborators to really get that systematic change that we also desperately need. Thank you.
Thank you, Sylvia. That was very interesting. As chair, you always have the benefit to choose things that are better to your feeling or closer to your feeling. So I will highlight a couple of things. it was nice that you started with that policy is scary. Indeed, policy is scary no matter from which point of view you look at it. It is, are all facing that. And actually, I liked it that you said that DM is not only due to the physical condition, but is also influenced by other indicators, for example, the environment and your own behavior. That's something we all should really keep in mind and try to work on that. And also the key roles of NGOs. I will share my own experience. I'm very active in the Caribbean in the field of spatial planning, urban planning, and environment. And actually, this is what we are doing. We are reaching out to policymakers and trying to really take them out of their comfort zone and expose them to the reality. And the indicators, actually the intervention of the 6th level, the frameworks, that's also what really fits in the multidisciplinary approach. It doesn't matter from which point of view you take it. So I think the work that you're doing is very usable and relevant for all fields.
Yeah. Thank you very much. Thank you to our two speakers, our four speakers, I would say.
Yeah.
Time for Q&A. I don't see any question on the Slido, but if please go to the microphone, you can start and then the others will follow, please.
Thank you very much. Thank you, Maimuna. Sam Saidi from Leicester, UK. My question is to Sylvie. I love your last comment. So if you were given a 5-minute brief period with a policymaker in a lift, you want to convey a message to buy into your proposal, the things you suggested, which one will you peg the person on? What was the most important thing that you would give it?
So I think the message that I want to portray is that there are a lot of quick wins, simple wins like the food labeling, like the schools. The school setting is so underrated. There's so much that we can do to enhance and shift behaviors of children by teaching them in school and making sure that they are learning by example, by what we offer them in terms of food and behaviors, etc. And of course, the first 1,000 days, mother and health, mother-child health, mother-maternal health, super, super important.
Thank you. Next one, please.
Hello, my name is Christine Malou from Lebanon. My question is also for Sylvie. Thank you so much for sharing all these insights. When you spoke about the nutrition labels, some countries have started to adapt the more simpler labels on the front packaging. Having a communications background myself, how can we unify these front labels? Because I've started to see that each country is adopting their own traffic sign symbol or their own nomenclature. And I do understand that countries have their own languages and their own cultural understandings. However, since this is the beginning of a transformation in the nutrition field, how can we ensure that countries can work on this together in order to make sure that people, it takes time for someone to recognize colors, logos, and new things. How can we work together as a globe so different people aren't doing the same thing but differently?
This is a very important question, and it's actually one of the most challenging of the policies, believe it or not. We had a lot of high hopes when we started. We thought, yes, let's get the GCC together, let's create a standard way to doing our food labeling, and there were a lot much more discord than we actually anticipated, and it's because there's different regulations, different guidelines of food intake. So what's high sodium in one country, maybe not high sodium in another. So I think this is where the people who work in the global entities like the International Diabetes Federation, hint, hint, VP right there, the World Health Organization really come to play. This is where the global NGOs and the collaboration really comes in, because you have to set those guiding frameworks in order to be able to unify. And colors are different in different countries as well. In Qatar, it's actually particularly difficult because 90% of the food, if not more, is imported. So a lot of the time they just have sticker label add-ons in Arabic language. So it makes it even harder to put those standards in place. But I know that, for example, the World Health Organization started with sugar content and sugary drinks, putting up some guidelines, and then some countries are starting to abide. So I think consumers have to be more vocal. You have to ask for it. NGOs have to be more vocal. We have to put our voices out there, make ourselves heard, and then the policies will respond.
Thank you.
Thank you.
Jamil?
Okay, one more question also for Sylvie.
Thank you.
So don't step
Policy is
out of the
complicated.
podium. The question is, as a Lebanese doctor, I felt proud when I listened to you and jealous at the same time. Proud of what you are achieving in Qatar, and I want to ask you, what about your achievements in Lebanon? What do you do, and what you will still do for Lebanon? What you did before and what you still do for Lebanon? Thank you.
No, thank you. I know it's always hard as an expat when you have those, because you achieve in a country that becomes your second home, but you always have your primary home. As you know, I'm a co-founder of the National Diabetes Association, Dialeb, in Lebanon. So I've been working a lot on patient advocacy and support, creating programs like diabetes in the classroom, diabetes in the community. I'm sort of the behind the scenes, the thinker behind what the programs should be, if you will. But I continue to always stay very close and to advocate for the needs of patients, especially when they were changing prices and increasing the prices of medication. We worked very closely with our diabetes community, particularly type 1, the president of the NGO and others to advocate to the ministry to include insulin in the list of the medicines that should not increase in price, and we achieved it. We also supported a lot with medicines donations to people that need during the worst times that Lebanon went through in the past few years. And I'll continue to give back as much as I can, of course.
Okay, thank you.
Great. Yeah, next one.
I'm Dr. Altaf from Pakistan. My question is to Ma'am Iram Anwar and her team.
And her team. Yes.
Well, as my Lebanese brother said it, that he is happy as well as jealous. I'm very happy that she is also from Pakistan, but I'm not jealous. I'm really fascinated by her work. My question is, it's wonderful effort from Pakistan. And if I tell you how much circumstances are there and how much hard is to do a public service over there, she really needs a round of applause for her services. My question is, you have this wonderful effort. Is it a multi-center, or you have efforted it in some countries of Pakistan?
Yes, if someone can play the slides as well. So yes, it's multi-centered approach. We have different public, charity, and private setups as well. Most of them are public setups because the maximum load of patients are over there. But apart from that, we have certain charity centers and anyone who feels the need. And we have also plotted these centers in a way that a maximum map of Pakistan could cover, so everybody could access it easily. We have 3 in Lahore, none in Faisalabad, but if you are interested, we can definitely connect and make one over there as well.
So you provide the digital support, or you provide the web or link support, or there is some human resource development efforts as well?
Okay, so if you have a diabetes care team, because you know in Pakistan, diabetes educators are catering more to type 2 diabetes. They are well aware about type 2 diabetes, but when it comes to type 1, not everybody has that access or has that knowledge that they can guide type 1 in that manner. So what we do is we provide digital support with this resource. We install the equipment in your center, and we also educate your team by giving them multiple training sessions to implement that framework in the appropriate manner specific for people with type 1 diabetes.
And your main center is in Karachi?
So there is no main center. There are different hospitals and institutes with whom we have collaborated. We have 3 in Karachi, one in Nawabshah, then in Badin. So in different cities, we have collaboration with different institutes.
How many you have in Punjab?
I have to count myself now.
5 probably.
More than 5, yeah.
It should be
Yeah,
probably
because
more
it's the
than
biggest in terms of population, yeah.
Right, thank you very much.
Thank you again. I think that we are coming to the end of this session. I think you will all agree with us that we had a beautiful session. You just showed us that by leveraging technology, we can improve access to information, foster community support, and ultimately create a more informed and empowered patient populations, empowerment that will allow them to be better advocates than healthcare professionals, isn't it? I think that you also showed us the importance, again, of collaboration, these cross-sectional collaborations, because I believe, and all of us will agree, that health cannot be left solely to the hands of healthcare professionals. We need to collaborate, and this is the wealth of this kind of meetings where the diversity of the different people who can help to improve health, especially when it comes to chronic diseases like diabetes, obesity, and so on. So thank you, ladies. Thank you very much, Anwar. Thank you, Salma. Thank you. We have just 1 minute left.
Okay.
Very short, please.
No, I'm not asking anything.
Okay.
Actually, I was also the part of this nutrition education program of the Digibit, and I'm really very much impressed the way they collaborate with us to make the platform easiest as possible for understanding and for all the compliance the patient can receive. So well done, Anna.
Thank you so much for being the part of our co-design team. Thank you.
Thank you to my co-chair as well, and thanks, ladies. Well done. Keep it up.